Distinguished gentleman from Arizona, Dr. Gosar.
Mr. Chairman, I'd like to submit for the record testimony from a ski area in Flagstaff, Arizona, which I'd like to highlight with talking about temporary workers.
Without objection.
And this letter basically highlights what we do in the West when we have temporary solutions as far as utilizing a ski area that may operate as little as 6 weeks out of a year, as many as 4 months out of the year. So that gives us a great idea. Mr. Spiro, have you ever run a business?
No.
So you never signed the back end of a paycheck?
That's correct.
How does, Mr. Gauss, how does your administrative costs, you've been in business for 30 years, was in business for about 27 years, in healthcare, by the way. How much has your overhead gone up in the administrative aspect in regards to rules and regulations?
I would say a good 75% over the last 8 or 9 years.
Interesting. Mr. Spiro, do you think the government has the right to turn out the lights on a business?
No, but I don't think they are turning out the light on business.
So how would you answer these two gentlemen that if these rules go into effect, and they're fairly nebulous rules, how would they stay in business?
Congressman, I haven't seen all the numbers and assumptions that they have used. All I can tell you is that the CBO studied this issue comprehensively. They looked at all the studies out there and concluded that the effects of the Affordable Care Act on labor markets would be purely marginal.
It actually shows, let's go back and recalibrate that, it actually shows that we lose a significant amount of jobs and costs incredibly more than was originally orchestrated. Was that not true?
I disagree with your conclusion.
And that's not what the CBO said.
They said that there would be marginal effects.
Let me ask you a question, sir. You're familiar with the Massachusetts model?
I'm somewhat familiar, but I'm not from Massachusetts.
Well, but you cited it, did you not?
That's correct. I did cite it in my
testimony. Has premiums gone up?
They have gone up as they have gone up everywhere around the country.
So it's not a solution.
In Massachusetts did
not a solution.
It was never intended to lower costs. They are now engaging in a second round of reforms, payment reforms, intended to lower costs.
So what you're saying to me is you're promoting, you actually highlighted it for me that it was a solution process, but it's not a solution process because we've seen these premiums going up all over the place.
It was a solution to the problem of the uninsured, and on that score, Massachusetts has been found to be wildly successful and popular, reducing the uninsured rate to a couple of %.
And let me ask you the question, where did that money be dumped on? Was it on the backs of the businesses or on the taxpayer? Let me answer it for you, on the taxpayer.
It was from taking the cost of uncompensated care and redistributing it so that it wasn't being shifted onto higher premiums for employers.
So let me ask you the next question. Premiums went up then or went down? So what's your analogy, what you just said, they should have gone down. They went up, sir.
They will.
We need to have them. When you run a business, you understand how those dynamics work, and obviously you need to spend some time in the private sector before you start putting out rules. How do you feel about that, Mr. Gauss? You know, does the government have the right to turn your lights off by these rules and regulations?
No, sir, they do not.
It seemed to me like there was a lot of nebulism in this. I mean, we talked about mini-med plans, and, you know, we asked the Secretary just to define the number to use in mini-med plans, and holy cow, we went off on tens of billions and tens of millions of dollars and gave waivers to 1,500 people or industries, you know, picking and choosing. And you think that was fair?
No, I don't.
How do you feel about that, Mr. Pritchard?
I would agree with Mr. Gauss. I don't think it's fair, and we're trying to run a for-profit business. We're trying to make a difference in people's lives. And as we have seen over the last few years, even with our current economy, it's not easy. And more regulations, more increased costs that we cannot pass on to our customers will force us out of business.
And a business is run on somewhat of a fairly certain environment. You have to have some variances of making sure that you're being able to, God forbid, make a profit, because that's the only way you can open your doors, keep your doors open to do that. Do you see the environment that was created by this law making it more certain or less certain?
I see it becoming less certain because the forecasting will be much more difficult. We look at hours right now, but we will have to look at hours in a very different way. Because of the fluctuation in hours of the temporary workers, it will be incredibly difficult to forecast. And people moving in and out of coverage will also be very difficult to forecast. The administrative and compliance piece will really be problematic for our business.
Thank you.